Today, 11 Alive Joe Hankey talked one-on-one with Governor Brian Kemp about the vaccination efforts here in Georgia.
He asked about the possibility of mass vaccination sites reopening and National Guard help on the way to overwhelmed hospitals.
Currently, only 43% of Georgians are fully vaccinated against COVID-19. Meanwhile, 50% have not received even a single dose. Governor Brian Kemp tells me, though, with Pfizer's vaccine now having full FDA approval, we could soon see an uptick in vaccinations.
Look, opinion polling out there of the folks that are unvaccinated, 3 in 10 of them are saying if there was, full approval, they would get the vaccine. So I hope that's the case. We're ready to administer it.
Governor Kemp maintains, in his opinion, statewide vaccine and mask mandates would only further divide Georgians, but he knows medical professionals are frustrated by low vaccination numbers, leading to crowded hospitals.
90-something% of the COVID patients in the hospital are unvaccinated, and there's just been some tragic losses of school teachers and principals and sheriff's deputies and, community and family leaders that have fallen to the virus, and unfortunately they were unvaccinated.
To reach a point of having 4 in 10 Georgians fully vaccinated, the state, federal, and private partners relied on mass vaccination sites. When interest dipped, those efforts ended, with booster shots now being recommended if you receive the Pfizer or Moderna vaccine, and Johnson & Johnson today releasing data showing a booster shot of its vaccine could also lead to a higher immune response. Kemp says the return of mass vaccination sites is not off the table.
We'll let the market dictate that, but we'll do whatever we can to help with that situation from a state perspective.
From a state perspective, Kemp last week pledged $125 million in funding to add 1,500 staff members to hospitals around the state. Tuesday, he announced 105 National Guard personnel will be heading to hospitals around the state to also assist. Those moves don't solve the issue of crowded hospitals, but Kemp says the extra staff is needed, and some are already on the job.
If you're in one of those hospitals that needs the help, even if you're getting 2 or 3 more people, it's making a big difference, especially in our smaller rural hospitals. And that's where, we're focusing.
And Kemp tells me the National Guard personnel are medically trained. We're between assignments and not actively working at a hospital already. So there's no concern about robbing one hospital just to try to help another.